This is Chida Musakli. I'm a pathologist working at PhenoPath Laboratories in Seattle, Washington. I am board certified in anatomic and clinical pathology and also in molecular genetic pathology. In the last couple of years, with the increasing interest in the immunotherapy eligibility testing, we have an increased volume of PD-L1 testing in our laboratory. So since I started this laboratory, I have been very closely involved with the testing, validation, and also sometimes with the clinical trials with the different antibodies. So we have a high volume, and we do not do hospital-based testing. So everything that is coming to our laboratories are coming with a requisition form and the basic information, the pathology report, and whatever the test is the physician's interested in or the ordering provider is interested in. So sometimes this is a difficult task to accomplish because I'm trying to provide the right result, the right score, or the right PD-L1 test score for the right tumor type and for the right patient. And there are many other factors that are being involved in that decision-making process. And sometimes the information is missing, or sometimes the information is confusing, or things are not that straightforward, black and white. So there's a lot of process in order to get to a final report. So I figured out that this is, in fact, probably a problem not only mine, but a lot of physicians who are working with me, who might start working with me, who might have to teach, or anybody who is working in a reference lab setting, or other people who are probably going to bring that test online and want to have a standard way of reporting things, or maybe a guideline. So when I learned about this project, I said, okay, this is perfect. And I can get information from other people who are doing this testing and also start a conversation in my laboratory about what we can do to make life easier for us and for anyone who is going to do this testing in the future.
Thank you so much. Tell us about some of the biggest challenges around PD-L1 testing before the project began. What were some of the biggest barriers that you faced in your lab?
So I think the main challenge is really directly not having the direct access to the patient or the ordering provider. It comes as a form, right? And you do not know much about the patient because you do not have access to the full clinical history. When there's a tumor that is, for example, in the lung, and it is diagnosed as a lung, it is very easy. There's very specific guidelines about what antibody may be to do or what kind of scoring that you are going to do. But when it's a tumor of uncertain primary site, or when there's a clinical history of multiple tumors, when the final report is not sent to you because they want to expedite this testing and get the results as soon as possible, which is a very important task, obviously, for any pathologist and as well as the oncologist getting those results. So you just have to run against the time to provide the right result, but at the same time, you sometimes don't have all the information that you need. And how much you are going to spend the time to get that information, what is really critical information, what is really essential, is a decision solely based on the pathologist's experience, how their comfort level is. And these are not set in stone as well, because it's a very dynamic area. There are many changes in the PD-L1 testing since it started maybe now 3-4 years ago, and you have to keep yourself up to date all the time. So I think those were my biggest challenges.
What were the steps that you took to move the project forward?
So I tried to form my village, and I tried to figure out who are the people who are the key decision makers, who are the people who are going to be able to help me get that information when I need the additional information, or who are the people who are maybe working at a similar platform or a similar system, and what are they doing? There's also the expectations that are set by us in a way as a leader. So I felt if I have a good set of guidelines that I can provide to people who are not doing that thing, I can learn while I'm trying to figure out what is the best thing. So I thought that maybe creating a survey initially to figure out what other people are doing is the best thing. So I sent a survey. The questions that I created mostly were things that I was curious about. And the other thing what I was trying to figure out was who are involved in this testing within the bigger laboratory that I'm working for. So then I realized that there's in fact a working group that was just implemented, was about to start having meetings. I became part of it. I think that was the most critical thing for me because it increased my confidence about where I am compared to anyone else. So that was definitely building a community, building my village was both the aim as well as the side effect of that project.
So what would you say were the biggest benefits that you gained as you reflected on what you learned?
First of all, it reinforced the idea that we were definitely leaders. We were very dynamic in implementing and bringing new antibodies. And what we were doing was representing the best guidelines If I'm providing the right information for the right patient most of the time, I do not get a phone call, for example, from the physician or oncologist, or what about this score? Why didn't you give this score? So I think that reinforced that what I was doing was the right amount for most of my patients. And whenever there was something that was unclear, doing a pause and getting that information was almost always beneficial. It helped me with that. Being part of that team or the working group in my own laboratory system helped me become a leader. And during this time, we also have another pathologist starting in our laboratory. It helped me train her. Providing the resources, providing the toolkit to her was driven by this project, because I was saying, this is the evidence, this is everybody is talking about, this is everybody is struggling with. I think this is the point that we can do this to prevent a problem, or we can do that to make a better result or report. And it also reinforced the idea that whenever there are new things that has to be implemented, or when there are new FDA approvals, how to do that, how to keep in touch with the FDA, how to sign up for the newsletters, or where to go when you have to gather information regarding the package insert. Those kind of things, I think, came from the discussions that we have as a group, from the survey questions that I created, and also the training that I did for a junior person. We will probably get more data, hopefully treatment data and the outcome data that will maybe change some of the thresholds. Maybe we will have more testing available in other tumor types. I'm expecting more antibodies coming along, more early stage disease that has happened, like for example in lung. Maybe we are going to go look more into the preanatal variables, which I think is very critical. These specimens are coming all over the country from different surgery suites, from different fixation and warm and cold ischemic times. I think to come to where we are for example, ERPR HER2, take a lot of time, but I think PD-L1 also deserves and needs that kind of uniformity with respect to the standardization of the preanatal variables. I think that will make the value of the immunotherapy or PD-L1 testing even more important.
So as you reflect back on the project, would you say that there are some key takeaways, things that you feel where you benefited the most?
I really liked doing something out of the work environment, because I think it's very hard to develop your self-confidence when you work in a private practice, when you do not interact with other physicians except for the people that you are working for or you are working with. Being involved in a project like this and then collaborating and hearing from all the other people in other institutions gives you the self-confidence to be able to express your experience. And in fact, realize that you are experienced and a specialist. It increased my confidence in that, especially during the COVID, because we do not have conferences anymore. We do not get to represent our findings maybe as these kind of like daily conversations that I would have, or a conference-based setting where we kind of like discuss these in person. That personal interactions really went away because of the COVID. I think interacting with people all over the country helped me understand my position and then make me feel a little bit more self-confident in what we are doing and the quality of our service. I'm very happy that I got involved in this project. It's really good to be a stakeholder in this area, because I think this is the future of the oncology. And it's good to know that the survival for the lung cancer is better than before. Knowing that you play a role in that, I think is one of the best satisfactions that I get from being a physician.